Dr. Bernstein is a board certified in pediatrics and specializes in neonatal prenatal medicine and pediatrics. He and the physicians at the Center for Neonatal Care provide comprehensive services and treatments for a variety of neonatal conditions. The center was designed to treat premature and sick babies at Florida Hospital for Children. For newborns that are in a high-risk pregnancy, are premature at birth, or are critically ill, the Neonatal Intensive Care Unit serves as their home until they are able to be discharged. The NICU is overseen by the neonatologists from the center. Please welcome Dr. Hilton Bernstein.
Good evening, everybody. I'd like to just take this opportunity of thanking Rosie for giving me the opportunity of delivering a small message to you all. As a young physician, I was faced with the decision of what specialty to choose. I enjoyed all facets of medicine, and at that time I was in South Africa and I applied and was accepted to do a 6-month stint as a medical officer in pediatrics at the Johannesburg Hospital. It so happened that my first rotation was in the NICU, or the NICU. My first baptism to fire was when the senior resident asked me to draw blood from the infant in bed 5. I went up there, all nonchalantly. When I got to the bed, I almost fainted. The infant was only 500 grams, which was just over a pound. All the nurses and personnel burst out laughing, and I realized that this was part of my initiation to the NICU. After spending 1 week in the NICU, I knew that this was my future. This was a different world to what I had been used to. Up to now, I had dealt with adult patients. However, these little helpless individuals brought out a very special emotion. I had never in my life felt so much compassion for such helpless individuals. The NICU is a unique place. The individuals that work there are very special people who devote their lives to the care of these vulnerable individuals. And I'm honored to have a couple of the people that I work with. And just to let you know that it's not only the neonatologist that cares for these infants, it's our wonderful nurse practitioners, our wonderful nurses. We have a chaplain that's very much involved with the patients. We have social workers. We have occupational therapists, physical therapists, and speech therapists, as well as child life specialists, all of which are involved in the care of these newborns. As care providers working in the NICU, in addition to the joy of seeing an infant that one worked very hard on, now healthy and going home to their families, one has to deal with infants that unfortunately can have poor outcomes. In addition, when an infant is doing well, it is a roller coaster of emotion for the parents and families. We have to deal with this, and this can be very taxing. One has to always remember to give the perception that the infant with mild disease is just as important as the critical infant. This was very much a reality check for me. I recall when I was practicing in South Africa, I took care of all pediatric patients in addition to patients in the NICU. I was caring for a very critical patient in the NICU, and after doing rounds in the general pediatric floor, the charge nurse from that floor called me to let me know that one of the mothers was very annoyed with me. I immediately went back to the pediatric floor. Her exact words to me were, "Dr. Bernstein, you examined my child and did not say a word to me and then left." The reality was that my mind was on the critical infant in the NICU. I explained this to the mother, and then I apologized profusely. I then emphasized to her that her child was just as important to me as the infant in the NICU. It taught me a very valuable lesson. I often tell parents that we will take care of their child just like we would want our own child to be taken care of. When there is a poor outcome, it is a time when families need a lot of support. As healthcare providers, it is also our inherent duty to support parents and families in their time of need. This is the time when parents need us the most. Often the parents are in various stages of grief, and as healthcare providers, we try and help as best as we can. We try and make ourselves available to the parents and their families as best as we can. It is not an easy process, and it takes its toll. The reality is that healthcare providers are also vulnerable to severe stresses that affect not only their professional life, but also their family life. It is very difficult to divorce the reality of what happens in the NICU from one's personal life. Some of us are able to hide it better than others. However, in reality, it affects us all. We take the loss of a child or bad outcome personally, and it can lead to feelings of despair. Nurses who are at the bedside all the time often experience severe emotions, and the level of burnout is high. Part of the stress experienced by healthcare providers is often the fear of expressing one's feelings in case that it may be perceived as a weakness. And often this has a snowball effect, leading to more stretch, which eventually bubbles over into one's family's life. We are not made of stone. One should never feel threatened to ask for help. It is not a failure, it is in fact a strength. I have always said that the moment I show no feeling for the patients that I am taking care of, that is the time to do something else. We are all human, and the vast majority of us are very caring and want to do the best for our patients. For most of us doing this job, it is a calling and self-sacrifice. I personally love what I do, and nothing on earth gives me greater pleasure than discharging a healthy child home to their families. I just want to emphasize another important point, that I am honored and grateful to work with such a wonderful group of individuals. You all make coming to work a very rewarding experience. Thank you.